Hi everyone, myself Dr. Sanju Cyriac, I'm a medical oncologist, and this is Dr. Teena Sleeba. She is the breast imaging expert of our hospital. So we are here to talk about a few facts about the breast imaging and the importance of that in the management of breast cancer. As you are all aware, breast cancer is the leading cause of cancer-related mortality among females, and it is important that we identify breast cancer at an early stage. And there comes the crucial role of breast imaging. So, the first step of anyone identifying a lump in her breast will be to go to a imaging specialist who will be doing either a mammogram or ultrasound or whatever method we have to do at that point of time, and that's how we come to a diagnosis of breast cancer. So let's talk a few facts about the role of imaging in breast cancer. Recently, we had seen a patient who had, I think, 5 millimeter lesion in the breast. She never complained of any lump in her breast. So, what will be the difficulty of such women to identify breast cancer? How did that patient come to you?
So, most of the women in whom we pick up breast cancers that are subcentimetric or really small are women who present to us for screening. That's the mammogram was done as a part of some kind of a health checkup, or just because they are concerned because they have a very strong family histories. Those are the women in whom we pick up very early breast tumors. So that just stands to say that the earlier you present, the smaller will be your tumor. So 5 millimeter, definitely she's not going to feel it ever. A mass has to be at least 2 centimeters or more for a woman to be able to feel it herself and present. So she was very lucky, and like you said, sometimes early detection. What we look for early detection on mammogram is not mass. It's not always a mass. We look for certain other early breast cancer findings, which include very tiny, what we call distortions, and sometimes microcalcifications, very popularly called stage 0 breast cancers. So that's the intention of early breast screening, to pick it up as soon and as early as possible.
Nowadays, we face a challenge because of the increased awareness. We know that people come to us with early breast cancers, but over time, the treatment paradigm has changed. Nowadays, we try to give what we call a neoadjuvant chemotherapy. That means giving chemotherapy before surgery, especially in types like triple negative and HER2 positive breast cancer. There comes a challenge because once you start chemo, the tumor is going to shrink. Sometimes it will disappear by the time we complete chemotherapy. At that point, how are you going to help the surgeon to locate the tumor? Because most of the time it disappears.
So I think that's a place where we play a very vital role. Most of the women who have these kind of tumors, like you said, the triple negative and HER2, they are usually very young, and almost all of them would want to preserve their breast.
Exactly.
So the idea is basically to shrink a tumor, which you would be doing with your chemotherapy, and remarkably in these women, the tumors just completely take off. We've
It's
seen.
not uncommon to see.
Yeah, it's not.
More than 50% of the time, the tumor just
Yeah,
disappears.
it just disappears to what we call a complete radiological response, meaning we can see no signs of the tumor being left behind either on a mammogram or an ultrasound or even on an MRI.
And gives reassurance to the patient also that
Yes,
the treatment worked.
yes, definitely. So at this point, we would still want to show the tumor bed or the site where the tumor, existed to the surgeon, because once in a while, under microscopy, that means under pathology, there might be some residual tumor cells that are left behind. So complete radiological response doesn't mean that wouldn't have to undergo surgery. She would definitely still have to undergo, but that site, if it can be pinpointed for the surgeon, he just has to take that bit of tissue around that tumor bed and come out. So for that, what we do here is we use Liga clips. These are surgical clips which are used to be drop in into the center of a tumor. For example, 4 or 5 clips are dropped into the center of a mass which might be 5 centimeter. Following your chemotherapy regimen, most of the women have nothing left behind but those clips which are right there at the tumor bedside. And intraoperatively, when she goes in for surgery, what I do is I inject a blue dye, a methylene blue dye, which kind of stains that area where these clips are there.
So this is a clip and glue method,
Yeah, this is a
which
clip
hit
and
the
glue.
headlines recently.
Yes,
And it
yes.
helped a lot of women.
Yes. And the thing is, What we did different in our case was instead of using the commercially available clips, which are very expensive, like they can cost anywhere between $250 to $450. What we used was the surgical clips, the vascular clips, which normally would be used in the course of a surgery for ligating or clipping vessels. So we used that, and it's extremely cheap. For example, like 4 clips might just cost about 400 rupees. So we drop 4 clips into the center of this, say, 5 centimeter mass, and you give chemotherapy, and this patient responds in a very in an excellent fashion. And at the end of her treatment, there is nothing left there except those 4 clips. Now, the surgeon has to be shown these 4 clips intraoperatively, because he wouldn't be able to feel it. Neither can the patient feel it. Neither can anyone see it for that matter. So what we do intraoperatively is inject a little bit of a blue dye into the site where this
That's
clips is.
methylene blue.
That's methylene blue. And the surgeon would just go straight down, get those clips, and come out. So 5 centimeter tumor, when it shrunk, it's almost zero radiologically speaking. And the amount of tissue that they take is very minimal. So almost every woman has an excellent chance of conserving the breast.
Yeah, and that is their main concern also.
Yes.
Whenever someone is diagnosed with breast cancer, the
Yes.
first question they ask is whether I can conserve my breast.
Yeah, it's very true, because we see this not just across young women, even women who are,
Yeah, exactly.
who are elder, who are grandparents, grandmothers, still would want to conserve the breast. So there's a lot of
and they have much better wound related issues, and
definitely,
I think better quality of life with,
cosmesis and quality of life. I think the self-esteem thing in women definitely matters in a country where women still present very late because they fear losing their breast. This is something that is something that's affordable. Something, what the clip and blue is, something that's very accurate, and we've shown that in our studies the clips don't move. And every time we've gone in 100%, we've gone to the tumor bed and got the either a negative tumor bed or some residual cells out. So we've never had encountered any issues with this procedure.
so that's a wonderful technique what we have developed here. What is the acceptance rate of mammogram nowadays in the public? Because we all face this problem, though we tell the public about the need for doing a mammogram as a part of screening. That means someone who doesn't have a lump in the breast, but still the acceptance rate was very low in the, say, a decade back. What do you think is the acceptance rate, and why do they hesitate? Are they concerned about pain or the radiation exposure or the fear of finding something inside their breast?
I think that's again a very good question. So, the thing is why women fear mammogram is primarily because there's a lot of negative information in the media, as well as what they have. They have some preformed notions about MR, that mammogram is supposed to be very painful. The thing is, in the present age, machines that we use for taking mammograms are very sophisticated, where a little bit of compression is given just to immobilize the part that is being studied. No, it's not like you give a whole lot more of compression, the image is going to come out much better. So that's a very false notion women have. In fact, several thousands of women we've done mammogram at Rajagiri, and I have never really encountered a patient who's come and in tears and saying that it was very painful. In fact, we've had a whole lot of patients who were doing it even for the first time, who said that is this all about? I mean, we were so scared about getting this done, and this was so very comfortable. So that is one. And second is, of course, there is always a fear that, what if something turns up? But then that is kind of fading, because awareness, in fact, is increasing. A neighbor, a friend, a colleague being struck with breast cancer.
We all encounter that.
People understand now. They're coming out, on their own. They're coming forward. They're coming to hospitals and asking. And like you said, breast cancer is the number one breast malignancy. I mean, malignancy in women. So yes, awareness does, is leading to increase in women who are just coming for screening purposes.
And the concern of radiation.
Yes. So, I think if you walk around with your mobile for 6 months, you possibly get the same amount of radiation that you get from incurring a
fear has
mammogram.
no
So again,
reason.
there are a lot of myths about mammogram, which, sometimes the myths actually exist among clinicians, among you and me. So, so it's very difficult to get that concept corrected when you have a physician's telling patient, why get a mammogram done when, you don't have anything in your breast. Start off with an ultrasound. The problem with ultrasound is a very, very operator dependent technique. So, you can be looking at a ultrasound finding and not realize that you're actually looking at a malignancy, especially if it's being done by someone who's inexperienced. They might absolutely miss a finding. So, therein lies the why ultrasounds don't really perform very well. But that said, in our population, it's an excellent modality to screen women too.
So we deal with a lot of breast cancer patients. See, go to any cancer center, the topmost cancer in any cancer center will be breast cancer because that's the way the numbers are going up. So how important is teamwork here? Because there should be a lot of communication. There will be a lot of facts which should be checked before deciding on the treatment, like the extent of the tumor, whether conservation can be done, whether there are microcalcifications, what is the type of the tumor, what is the status of the axillary lymph node. There are a lot of factors involved here. So, what will be the ideal situation where a breast cancer treatment should be the way it should be managed?
Yeah, I think you know how we operate here. So for us, every case is like a mini tumor board. Every case, it's like give you a call, you give the surgeon a call, the surgeon gives me a call, we speak to the pathologist. So every case is different, and I think the biggest strength of treating a woman who has a breast cancer is that a very robust team of highly qualified and dedicated professionals need to be behind her, to be backing her, and I think that is her greatest that's her greatest boost in facing the challenge
You're
of breast
absolutely right.
cancer and undergoing treatment. And that's thankfully that's something we have been sharing over years, all of us. So that said, every case is different. Every case, you might think clinically there is something, I might see something else on imaging that is conveyed. Similarly, the surgeons might be opting for one type of surgery, but there might be a finding which might need me to undertake further imaging like MRI, and that might just change the whole plan. So every case is discussed, and I think that's very, very good that we do that for each and every patient who come to us.
As a doctor who is dealing with the mammograms on a daily basis, you will be doing thousands of mammograms or 10,000s, a lot of newly diagnosed breast cancer. You've seen the pattern over the years. So what will be your message to the public?
I think, yeah, breast cancer is definitely on the rise. There are times where I have felt that is it some kind of an epidemic, because we see it every other day. Today, my youngest patient was 26-year-old. So we really can't explain why this disease is on the rise, or why are we seeing it so frequently across all ages. So awareness, and awareness. That's all I would have to say. So if you face something at an early stage, everything is becomes very easy for us. We can help you out. Early detection leads to early, limited surgery, and you tend to get to keep your breast, and everything works out well for you. You're 100% cured. So the later on that's detected, things don't go the way as we
That's
expect.
true. And even stage 1 to 3, but previously we used to tell stage 3 patients do very poor, but nowadays stage 1 to stage 3, they're all classified as early breast cancer because with the improvements of whatever treatment modalities we have, so probably we are looking into survival of say more than 80%. That means 8 out of 10 patients will be cured. So I don't think there is any other malignancy which is existing which has this much high cure rates, and there is no place for fear, I would say.
Exactly.
So I
Exactly.
think we should, if you are feeling a lump, you have to come out, do the imaging,
Yes.
find out at an early stage. Never hesitate to do the imaging. Never keep the lump to yourself. Come out,
Exactly.
speak for yourself, get cured.
Yeah,
That
there are
should be the
people to
message.
help you out. That's what women should understand. You really don't have to go through it on your own.
Exactly.
If there's something that's bothering you, there are a whole lot of professionals who you can just come up to, and just let us know what we can do for you. We are at your service. And another thing is, like you said, we see a whole lot of stage 4 women who with metastatic cancer who have gone on to live for years and who
Exactly.
are still doing so good. So yeah, I think possibly breast cancer, the kind of the way treatments from your side have changed over the years has led to all of this: better detection, better treatment, better surgical options.
Thank you so much for your message
My
and time.
pleasure.